go.
Okay, so we're going over the two different breathing circuits. We have a non-rebreather. We also have our rebreather. So I'll go over our non-rebreather first. So in general, this is for patients about 25 pounds or under, depending on their body condition and their stature. But the two different liter size bags that you use for one of these is going to be a 1 liter or a ½ liter bag. So to put that on, you're going to put that on right here, right under your pop-off valve that you'll use to breathe for your patients or to leak test your breathing circuit. This is going to connect to your trach tube once you have your patient all set up and ready to go. And then you've got this blue hose here. This is going to connect to your F-air canister. This is your scavenging system for a non-rebreather. So if it doesn't fit directly, you can find a little piece that kind of helps everything fit together. And you do have these little holes at the bottom that help vent your F-air canister. It's very important that it's always either on its side or in one of these little holders that keep it from touching the ground flat completely. Because if it lays like this, it's not going to have any flow and it's going to cause a lot of problems for your breathing circuit. So that's your non-rebreather. And when you want to go to actually connect it to your anesthesia machine, you want to take this clear hose at the bottom. This is your gas outlet. And you're going to connect it right here. It's a little bit different on all anesthesia machines, but on this one, that's where our gas outlet hose is. And then your F-air canister, this is a brand new one. You do want to make sure that you write about how much it weighs and the date that you start using it. And you do want to weigh this after you use it every single day. Once it increases by 50 grams, which is on the side of your instructions here, you want to go ahead and toss it and get a new one. And then for your rebreathing system, you've got these two hoses here where they're going to inhale and exhale their anesthetic gases and their oxygen. This is where you're going to connect your endotracheal tube once you've got your patient hooked up. There are, this is your pop-off valve on this one. It's a little different on every machine. For this one, you just screw it all the way shut if you want to have it closed, and then to open, you just open it all the way up. And then your breathing bags, your reservoir bags are right here. We actually have two on this machine because it has this nice little lever that you can switch back and forth between the two on. You just want to make sure that whichever one you're set for, you have this all the way pushed over to the left or the right. And then you've got your gauge right here that's going to measure how much oxygen and pressure you have in your breathing system. You want to pay special attention to that if you're breathing for your patient. And then again, you want to make sure your gas outlet is connected properly. If it's not, your patient's not going to get the ISO that they need or the oxygen that they need. And you're also going to end up breathing in stuff that you don't need to. And then we've got our soda lime here that we've already changed and set up. That's going to also help filter some of that waste gas. And then that is everything you need to know for setting up your breathing.